Hi, my name is Thomas Foley. I'm clinical assistant professor at Binghamton University, the State University of New York. I have over 15 years of experience in health promotion and disease prevention, which includes teaching about the U.S. healthcare system and health systems across the world. I'm excited to share contents of a package that I just received from Springer Publishing, which has a book that I worked on for over 2 years called Health and Healthcare Systems, A Global View. I serve as the first editor, in addition to being an author and co-author of several chapters within the book. The reason why I decided to spend a great deal of my time in the creation of Health and Healthcare Systems, A Global View, is to address what I saw as a lack of true representation and diversity in the comparative global health and health systems literature. There are groups of people, country, and regions of the world who are far too often ignored in the global health literature. Health and Healthcare Systems, A Global View, addresses this lack of inclusion and representation. There are more than 15 countries coming from 13 regions of the world that are featured in this book. The chapters that cover health, healthcare, and the determinants of health from specific countries are, for the most part, written by researchers who come from the countries that are being written about. The book consists of more than 80 contributors who span the globe and health disciplines, which is another great feature of this book, that it's interprofessional. Because it's interprofessional and has great inclusivity from across the world, it provides a more holistic view of health and addresses important and often ignored health equity issues such as indigenous health and the impact of historical injustices on health outcomes and health systems. Traditional and integrative healthcare practices in each country are described along with their modern allopathic system of healthcare delivery. Health and Healthcare Systems, A Global View includes an introductory part centered on foundational concepts of global health. There are 3 chapters in the introductory part: global health systems, global health outcomes, and global determinants of health. These 3 introductory chapters provide definitions of key terms and concepts that will be used throughout the book, in addition to providing a framework on how to read the book. Health and Healthcare Systems, A Global View also includes a concluding part focused on global health moving forward. The concluding part consists of chapters that focus on climate change, communicable diseases, population aging, mental health, and forced migration. These concluding chapters describe key issues that the global community needs to focus on to ameliorate global health and mitigate international health inequities and disparities in the future. The structure of Health and Healthcare Systems, A Global View, allows a course to easily be organized around the 15 strategic parts, which are the introductory part, the 13 regions of the world that feature specific countries within those regions, and the concluding part that focuses on key issues moving forward. The book also includes Course Connect and instructors' manuals for each of the chapters, a large test bank with hundreds of questions, sample syllabus, and instructor chapter PowerPoints for each of the chapters of the book. Learners who use the book will gain a better understanding and awareness of different cultural beliefs and practices, ecological factors of health and disease, approaches to improving healthcare structure and delivery, and health outcomes and concerns from across the world. As learners progress through the book, they will garner a better understanding of historical international health inequities, where and why health disparities occur, and what needs to be done to ameliorate global health. For these reasons, I'm excited that Health and Healthcare Systems, A Global View is now available for both educators and learners. Now more than ever, health equity on a global scale is needed. To promote better global equity, there needs to be greater global inclusivity. This book is an exemplar of international inclusivity and diversity of people, regions, and countries. I want to thank you for your time and again encourage you to get a copy of Health and Healthcare Systems, A Global View, and share it with others to promote better inclusivity and equity on a global scale.